The San Diego A Heart Attack and Stroke-Free Zone program is a collaboration of local healthcare organizations. Their hands-on approach involves helping patients monitor and control their blood pressure from home. Dr. Anthony DeMaria, the program's principal investigator at UC San Diego Health System, and Dr. Nick Efantides, Chief Medical Officer for County Health and Human Services. Welcome.
Thank you.
Thank you.
Now, Dr. DeMaria, heart disease is still a #1 cause of death in the U.S. among men and women, I understand. What are the signs of heart disease, and why are so many people still unaware they have a problem until it's too late?
Well, the signs of heart disease are actually fairly straightforward: chest pain or shortness of breath. But heart disease can be present for quite a long period of time before symptoms show themselves. And what we're focusing on is even earlier in the process, and that's on risk factors. So that risk factors that are present can lead to the appearance of disease, which subsequently can become symptomatic. We want to get it at the risk factor stage so we can eliminate those heart attacks and strokes.
One of the risk factors is, of course, high blood pressure. How does it contribute to heart disease?
Well, high blood pressure is one of the major risk factors. We know it increases the risk of heart disease dramatically. It also is a major risk factor for stroke, and it's stress on the vascular system overall, and in stressing the vascular system, it facilitates the appearance of these atheromatous plaques that are the real cause of the heart attack and the stroke.
Kind of the hardening of the arteries and the plaque in the arteries?
Yeah, we call it hardening of the arteries, and it often is because those plaques get calcified, but they start with lipids, cholesterol in particular, that's in the plaque, and it's like kinking a garden hose. You just can't get enough blood through that kinked artery, and ultimately, if a blood clot forms, you can't get any blood through, and that's the heart attack or stroke.
And Dr. Nick, this 3-year project that we're talking about aims to reduce heart attacks and strokes throughout the county. How's it going to work?
Well, we are going to start off with targeting individuals who are high risk, individuals, 4,000 folks who we know are very likely, if they go untreated, to end up having heart attacks. But what's exciting about it, and why the county is so supportive as part of Live Well San Diego, is that it really is a collaborative effort involving every major medical group in the region and a lot of smaller medical groups and community clinics working together for a common cause. We're going to be promoting compliance with medication. We're also going to be providing patients extra encouragement to take the medicines that they're supposed to take, and also have some exciting features like wireless blood pressure monitoring from home that will hopefully encourage folks to be compliant, consistent with taking their therapy.
And that help you're talking about, health coaches are going to actually come to the home. Now, Dr. DeMaria, why do patients need help taking their blood pressure medication? Why is there non-compliance?
Well, there's non-compliance for all medications. Adherence is a major problem within medicine, but it's particularly important when you're treating a condition that is not associated with symptoms. People who have high blood pressure don't have pain. People who have high cholesterol don't have aches or immobility. And so they're taking a medication now not to ease a symptom, but to prevent something in the future. And it's just so easy to say, oh, I just won't bother with it right now.
And Dr. Nick, when does this program start, and who's eligible?
Well, we have started the planning already. We had a big meeting this week. The program begins in earnest in September, and we're going to be recruiting patients towards the end of this year into the early part of next year. This program that we're talking about specifically today was funded by the federal government, so there's a focus on high-risk individuals who have Medicare or Medi-Cal. But our hope, as we do good work with these folks, would be to take it broader to the entire population of the region.
Well, you mentioned 4,000 participants in there. How can people participate?
The decision for participation is really going to come through the medical groups that they're a part of, and so we have many of the groups in our region who are actively involved. It's something that we would encourage patients to ask their physician about.
Well, I know the long-term goal of this program, as you said, spread it across the entire county, but in the title it says San Diego Heart Attack and Stroke-Free Zone. Let me start with you, Dr. DeMaria. How realistic do you think that goal is?
Well, I think that it's not realistic in the precise sense of eliminating all heart attacks and strokes. However, by modeling studies, we know we can reduce heart attacks and strokes by probably about 2/3 and perhaps more. So we can make an enormous difference. More importantly, by making San Diego Heart Attack and Stroke-Free Zone, it makes everybody a participant in the project, not just for us. And we appeal to them to take care of themselves, not for themselves, but for some loved ones. And that's where the be there comes from.
And Dr. Nick, do you think it's possible?
Absolutely, I think it's possible. Too much of what we currently do in America, it's sick care. This is really about health care, being proactive and preventing bad things from happening in the first place.
All right. Well, Dr. Nick Ifantidis and Dr. DeMaria, thank you so much.
We appreciate the opportunity.
Thank you.